students' wallets. So these are big things that we hope that students don't have to go through, and we're hoping that it comes to a quick resolution.
Northgate Square welcomed an unusual, important, and special exhibit for the last couple of days. Carrie Trousen has this story of something we should all be very aware of: colorectal cancer.
Giant colon was set up in the mall to bring awareness to what else but colon cancer. However, it isn't the cancer these doctors, specialists, and survivors are addressing. It's the screening, the early detection that is the most important. Tests like the fecal occult blood test, a simple test that can be done in the privacy of your own home over just 3 days, could actually save your life.
When you do the FOBT, which is the screening tool for the colon cancer check program, you have a chance of detecting colorectal cancer early. And when colorectal cancer is detected early, it's very treatable. So that's why people need to go and walk through this colon, speak to their family physician or pharmacist or Telehealth Ontario and get screened, because it may save your life.
The FOBT is easy to use, but statistics show in 2007, less than 1/4 of Ontarians aged 50 to 74 had done one. That's one of the reasons this giant colon is so useful. It pokes fun at the topic, making it a little easier for Ontarians to digest.
I think a lot of people, when they speak of cancer, they want to sort of put their head in the sand, because with many types of cancer, and particularly with many types of cancer in the past, cancer was a death sentence. So why find out early that you have cancer? You might as well just wait, because if it's not going to change anything, there's no point in knowing. But that is completely different, especially with colon cancer and with many types of cancer now, that the earlier we pick it up, the better we can treat it and very often cure it.
It's not always easy to speak about your colon and your rectum, and to speak about stool, poop, etc. And this is a great conversation piece. It attracts attention. People want to walk through it, and as you walk through it, you get educated. So I think it's great from that perspective. It draws the attention that we need desperately in Ontario, because Ontario has the highest rate of colorectal cancer in Canada and among the highest rates in the world. We don't know exactly why that is, but that's why we need to have a very aggressive screening program. And
Shirley Taylor, a retired teacher, found out she had colon cancer a few years ago. Taylor says because her cancer was detected so early, she didn't need any treatment at all, and attributes that to simple early screening.
I had symptoms, got to the doctor right away, got to Dr. Schulman right away, and it was done. I think at this point in our lives, the embarrassment should not be an issue, for the very simple reason the advantages are so great.
According to the Canadian Cancer Society, in 2009, over 8,000 Ontarians were diagnosed with colorectal cancer, and of that 8,000, over 3,000 will die from the disease. But what many of us don't realize is there's a 90% chance that colorectal cancer can be prevented through regular, repeated screening.
Some cancers, it's very, very difficult to, you can hardly even screen for them. Some cancers, when you end up getting them, they're already late. But this is one that if you detect it early enough, you can prevent those deaths. And that's why we want people to start talking about it and really sort of come out of the bathroom talking about it, that we can deal with this. We can test you and we can treat you. And very often all you need is just a very small surgical procedure to cure it.
To get more information about this important health initiative, talk to your healthcare provider and check out coloncancercheck.ca. For Cogeco North Bay News, I'm Carrie Trousen.
Thank you, Carrie. Nice job. Monopoly maker Hasbro has launched a contest to choose the best city in Canada. North Bay is one of 65 cities in the country vying for